Hello, and thank you for joining this webinar. Today, I'll be talking to you about managing severe and profound hearing loss with and beyond hearing aids. My name's Shahad and I'm from the Support and Community team at Advanced Bionics. The role of our team is to support people through their cochlear implant journey, and we do this by either directly supporting candidates or supporting you to have good conversations with potential candidates and to support recipients post-implant. Let's start by thinking about the challenges of severe and profound hearing loss. We all know that hearing with or without a hearing aid is limited by the processing capability of the peripheral and central auditory system. Very few patients with severe sensorineural hearing loss will achieve high levels of speech recognition in complex listening situations. This is because severe and profound hearing loss impacts communication in several ways, including inadequate speech audibility, loudness sensitivity as a result of a small dynamic range, a susceptibility to background noise, and the potential for dead regions. So as well as threshold elevation, they're likely to experience poor frequency selectivity and distortion. So all of this needs to be taken into consideration when fitting hearing devices for this patient group. Particularly for adults, a routine hearing aid fitting is not going to be sufficient, and thinking beyond hearing aids is essential. However, hearing aids are where we have to start. So this is a publication by Laura Turton and colleagues from 2020, which gives a really comprehensive evidence-based guidelines which are tailored specifically to adults with severe and profound hearing loss. They make some key recommendations on optimal hearing aid fittings, taking into account individualized assessments, person-centered care, and holistic rehab strategies. This is a really great resource to have in your toolbox when you're considering hearing aid fittings for someone with severe and profound hearing loss. And if you follow these guidelines, you can be confident that your patient is optimally aided as required for a CI assessment. So we'll just go through some of the main points for consideration when you're thinking about optimally aiding someone with severe to profound hearing loss. It goes without saying that we need to make sure that these clients are fitted with aids that have enough power for their loss. So don't be afraid to talk to them about power aids, even if they may not be as cosmetically appealing, because they will need the gain to meet their prescription. We want to use comfortable, deep and well-fitted ear molds that form an acoustic seal so that feedback doesn't occur, and feedback managers that limit gain are not required. Hearing aid settings can be optimized and fine-tuned based on subjective feedback, and this should always be the gold standard because their feedback will better represent their real-world listening situations. Hearing aid wearers might require a period of acclimatization to allow them to accurately report on sound quality and provide that good quality subjective feedback, so bear that in mind. Always offer a volume control to allow the wearer to have more control over their sound as they need to, and if you can, split this between the ears for better directionality. Consider things like the telecoil loop and the potential for wireless connectivity, for example Roger microphones, so that they can be used in more challenging listening situations. And you might also want to consider additional hearing aid features that can provide benefits, such as directionality, noise reduction, or a music program that can be selected and adjusted based on the client's preference and listening needs. Frequency lowering can be selected, but listen to the client's feedback on this. Make sure that audibility is improved and speech quality is not impaired. And finally, the client needs to be counselled on what amplification can deliver for their level of hearing. Their expectations need to be explored when you're thinking about goals and management plan agreements. And all of this should hopefully help you to get the basics right, have realistic expectations, that's you and the client, about the limitations of hearing aids for severe and profound hearing loss, and avoid excessive fine-tuning, which is not going to significantly improve the client's outcome, but it might inadvertently delay their onward referral for more effective management. Looking beyond hearing aids, what do we need to consider? When debriefing test results, give the conversation real meaning by explaining their results in detail. Never assume that the client already understands. Be prepared to discuss the possibility of cochlear dead regions and the specific challenges of severe and profound hearing loss. Clearly outline what this means for hearing aid use and always link that discussion back to the client's individual problems, goals and needs. If your clinic looks after children, look out for signs of insufficient hearing aid benefit, for example, speech and language delay, a lack of auditory milestones or poor aided thresholds, and use tools to help you track their listening development. This personalised approach really sets the stage for exploring appropriate rehabilitation options, such as assistive listening devices, remote microphones, or referral for a cochlear implant assessment. Make it as easy as possible for the client to understand their loss. Use visual tools if you can. This can really help to start the conversation and help them to understand. Follow-up care plays a vital role, particularly when discussing cochlear implant referrals or reviewing speech test results. It provides time for patients to trial solutions in real-world settings and helps build trust and rapport. While speech tests can be useful, they're not always essential, especially for adults with profound deafness, where results might be extremely low, potentially discouraging, and offer limited clinical value. In these cases, time might be better spent discussing the meaning of results, linking them to lip reading skills or counselling on other communication tactics. Where speech testing can be most useful is for borderline audiograms or patients who appear not to hear as well as their audiogram might suggest. Poor speech scores, even when the audiogram is outside referral criteria, might indicate dead regions and so can still point towards the need for a cochlear implant assessment. Cochlear implants should be part of the client's continuum of care. Introduce cochlear implant discussions early in the client pathway, well before they become a last resort. Be open and honest about eligibility from the outset and prepare clients or parents and caregivers for the possibility of referral so it doesn't come as a surprise. For progressive losses, maintain regular conversations so they have a clear understanding of implants before their hearing declines further. And as we've mentioned, you can use aided A/B word testing as a helpful guide for referral. Remember that 50% is implant criteria. It's not necessarily referral criteria. So don't hesitate to discuss speech scores and referral decisions with your local cochlear implant team. Even with thorough counselling, some clients or families will still have questions, doubts, or hesitations. Their concerns might relate to the surgery itself, the outcomes they can expect, the commitment required for rehabilitation, or how their life may change afterwards. Offering additional information, personalised guidance, and opportunities for peer support can help them to feel more confident and informed about their next steps. It's normal for them to need extra time, reassurance, and support before making a decision. This is where support and community can really help. We understand that time pressures or confidence barriers can sometimes make it really difficult for clients to feel fully informed about moving forward, and that's where we can help by using our clinical experience to provide the information, reassurance and guidance they need to make a confident decision. We can offer one-to-one consultations where we can talk about their suitability for a cochlear implant. We can explain the technology and how it's different to a hearing aid, and we can make this very person-centered so they're only hearing about the technology that's relevant to their story. We can share useful resources. We can even get them started on some rehabilitation that might help them throughout their cochlear implant journey. And sometimes, most importantly, we can put them in touch with a cochlear implant wearer or a parent of a child with a cochlear implant so they can talk to others who've lived through the experience. This can really help to reassure them at a time of uncertainty. We accept professional or self-referrals by email, or anyone can book a consultation with our team through our one-to-one booking link. Here are some examples of what people say about the support that we provide. We always have really good feedback after these sessions. People feel supported, well informed, and ready to go on to the next step of their cochlear implant journey with confidence. And for some people, this extra support can really make the difference between them taking the next step or not. Community also plays a really key role in helping people move forward. So here are some things that people say about community and peer support. Our mentors are really good at creating warm, inviting spaces where people feel heard. They're trained on supporting informed choice and not advocating for one outcome, but just sharing their experiences to better inform the people that they're supporting. We really do invest in our volunteers to make sure that they have the skills they need to carry out this really important role. And we're lucky to have teens and parents within our community as well who are fantastic at supporting across the ages. So hopefully you're all aware of the current cochlear implant guidelines, but I just wanted to add these in as a reference. So for adults, they include hearing levels of more than or equal to 80 dB HL at 2 or more frequencies, between 500 Hz and 4 kHz, and a score of less than or equal to 50% on the AB word test presented at 70 dB HL. And for children, the PTA criteria is the same, and hearing aid benefit is assessed by looking at the development and progression of speech, language and listening skills. But for children, really early referral is key for the best outcomes. So we don't want to wait for speech delay to make a referral. If you believe a child meets the threshold criteria, make the referral and the cochlear implant clinic will do the rest. It's also important to remember that there are some circumstances where referral guidelines may not be strictly followed. You may not come across cases like this a lot in your practice, but I think it's important for you to be aware of them. So for example, clients who have meningitis should be referred for assessment immediately, even if their hearing thresholds aren't yet confirmed. So the assessment process can begin and scans can be carried out to make sure that implantation occurs as soon as possible before full ossification of the cochlea for the best outcomes. Also, clients with other sensory impairments might be considered if they're outside the audiological criteria, because they're more dependent on their hearing. And clients with ANSD may also be considered with better thresholds if they're not gaining adequate benefit from hearing aids. So look out for those and discuss them with your local cochlear implant team. If you're ever unsure about a referral, you can always talk to us or your local cochlear implant clinic for advice. It's always better to refer someone who is not eligible than to not refer someone who might be eligible. So this brings us to the end of this topic. Thank you very much for listening. If you do have any questions, please let me know. You can contact the support and community team by email at here-uk@advancedbionics.com. But before I leave you, I would also like to take this opportunity to invite you to join our Severe and Profound Professional Network. We started this network a couple of years ago, and it's designed to support professionals who are working with people through their hearing and cochlear implant journeys. We have around 300 professionals now within the network, and we always plan a really exciting schedule of events and learning opportunities across the year, which we can share with you once you register. So the link to register and receive more information is here in the SAP network sign up, and there's also a link to join the WhatsApp community to be the first to hear updates from the network. There are some references and useful links here for you, which you might want to look at for further reading. Hopefully you should be able to download these, but you can always contact me for a list of these if needed. Thank you again. See you soon.